day, everyone. Welcome back to my channel. My name is Dr. Yinike. Welcome back today. Thank you for joining us. Thank you so much for all the support so far. If you were not here on the last episode, last episode we spoke about so many things. We spoke about our women reproductive health organs. We spoke about our uterus, our fallopian tubes, our ovaries. Just briefly, in summary, I will go through that again. So we talked about the pelvic organs, talked about the uterus, the fallopian tubes, the ovaries, and then we educated ourselves on the cervix as well, knowing what these organs, where they are, and then their names. And then we talked about the breast and the areola and the nipple. We talked about them briefly. So on today's episode, we're talking about investigations that we are supposed to know as women, that we're supposed to know, and we should have done some of them. It will be a shame in this Gen Z era that some people don't know their genotype. Is it you? Are you there? Are you among?
Stop it! Stop it! Stop it!
You need to know your genotype. You need to know your blood group. Haba, in this Gen Z era, people have internet to see. So you pay for data to see what is going on in people's life. Now you know who marry wrong. Now you know who marry right. Now you know who do this, who do that, but you don't know your genotype.
Oh my God!
You need to know it. On a more serious note, let's talk about this. Let's go deep into this. So we're talking today about medical investigations that we should know as women, and then we should have done as women as well. On the screen, I'll be sharing with you investigation generally that we're supposed to do. Women of reproductive age, we've gone from 18, let's say from 20, 21 years old. These are things that we should actually check on a yearly basis. Even because we live in an environment where, even at work, they don't really care about our yearly check. But as women, we owe ourselves that responsibility to check these things on a yearly basis. Even if it will cost us some money, some amount, let's just try and check it. Because the result of this will determine whether we're going to live a good life or not. So now, I say we start with PCV. That's under full blood count. Why I wrote full blood count here is because under full blood count, they will check your PCV. They check your leukocyte counts. PCV is called packed cell volume. I did not say PVCO. I did not say voter's card. I said PCV, packed cell volume. So it's going to check your blood level to know. There are some people that are anemic. They feel dizzy all the time. They have headaches. They have these things. Because they don't know this, they don't even know what is wrong with them. They will take a lot of concussions without even trying to check the little things that might be causing this issue. It just needs to be corrected. So please, let's check it. Another thing that we need to check is the blood sugar level. Our blood sugar level is very important that we check. Even if you're checking once in 6 months, fasting blood sugar, check it. Know whether you are still within the normal range or you are tending towards pre-diabetes or you are already in the diabetes era. So you know how to correct it on time before it destroys something in your body. And then we need to also do a blood pressure check. Blood pressure is a silent killer. We need to check, even if you are checking your blood pressure once in 6 months and once in 3 months. If you don't feel anyhow, of course, if you don't have any complaints or anything, but if you check once in 6 months, it can go a long way. Kidney function test, liver function test, thyroid function test. Sometimes we require these examinations when patients complain about certain things, so we require it. But you see, this main one, urinalysis, to check for infection. If Adam and Eve era, so we need to check these things for infection. So the main things that you need to look out for general analysis is your full blood count, to check your PCV, leukocyte count, full blood count, blood sugar level, blood pressure, urinalysis. Please and please, let us take note of this. Now I'm moving on from general tests to tests that we actually need to do. Reproductive age. Look at it. Pap smear. There are some things that will cause cervical screening. Please and please. Cervix, cervical screening. Cervical cancer is one of the leading cause of death nowadays. Please, we need to take note. So many people are living with cervical cancer and they don't know. Please, let's take notes. We have the pap smear that should be done every 3 years. The HPV test, also, we have it. Please, let's take notes. There is a vaccine, that is the HPV vaccine, to avoid all of this kun that can be taken. Under the scheme, from 9 years old can take HPV vaccine. Let's take notes. Mommies, our daughters, once they are 9 years old, let's take them to nearest primary health care center. They can direct, if they don't give it there, they can direct us to where we can take it. It's very important to take this vaccine, HPV vaccine. So we do the pap smear every 3 years, HPV yearly. Then pelvic ultrasound scan is very important. It's very, very important that we do our scan once a year. So many things can change. Trust me, under a year, so many things can change. Breast ultrasound is very important. Don't just let that brother be touching and be touching everywhere without you taking care of yourself. If something goes bad, trust me, brother will look for another person. You need to take very good care of yourself. So breast ultrasound, we require it for women below 40 years old. Above 40 years old, we require a mammogram to give us a detailed view of what we want to see. That being said, so we're going to move on now to premarital investigations. When I mean premarital, Ashwebi ladies.
Listen, Ashwebi ladies.
People are ready to dance, people are ready to do everything. Well, you have not done the test you're supposed to do, my sister. There's some things you're supposed to know now. Haba. Don't just go and pick Ashwebi. How can you be? You don't know your husband's genotype. You yourself, you don't know your genotype. Should I wear the glass of shame for you? No, I will still pity you. Because that's what we're here for. So please, you and your husband, you have to do a genotype blood group. Please, you need to know these things to avoid issues. So now, I'm going to list them out for you. You do a blood group and results. You do HIV screening, hepatitis, and syphilis. Why I'm saying this is because, look at it. You yourself in your church mind, you know that you have some illness, some diseases, but you don't want to tell your partner. Why? Isn't it better you tell your partner? The partner should know whether he's ready to go ahead with you. Do you want to be in that marriage and then you suffer so much with guilt, with pretense and all of that? So it's important to do these things. Let your partner know your status. You guys should check these things. Know it. Don't enter marriage. Don't follow love alone. No. Follow the ladder. Hey, don't follow love alone because it can harm you. It can do you more harm than good. So please, let's take note of this. Our blood group, our genotype, our full blood count, HIV screening, hepatitis B and C, syphilis screening, urine analysis. Please, emphasis on seminal fluid analysis for the men. You need to make sure that you know that your husband has done this so that you will not be suffering from things that you don't know anything about later in your marriage. Oh, let me tell you, in marriage, if a woman does not conceive, she's the problem. They don't even look at the man. It's the woman. And nowadays, statistics even shows that men have more issues than women nowadays. So please take note of these things. So don't go and be suffering things you did not or you did not do. Then why I'm going to go back to this blood group and genotype is because, trust me, there are a lot of people that don't know their blood group and genotype. Some people know it, that my mommy said that my genotype is AA, but actually they don't know it all. They don't even know, they're not sure. Now, this is for you. Look at this chart. AA and AA can marry. AA and AS can marry. AS and AS run. SS and AA can marry. SS and SS, my sister, run. AS and SC, run. AS and CC, run. AA and SC, AA and CC, they can still marry. The major types of genotype, they are the AA, the normal ones. AS, they are carriers because they have the S gene. SS is the sickler gene. Please, even pity yourself. You don't want to bring to the world children that will suffer. When you marry SS and SS marry, oh my God, if you see things that the children go through, they go through a whole lot. You stand and you look at yourself and you regret decisions that you have made because of love. Because of love. Think twice. On a more serious note, SS and SS, it causes more damage than good. So please, let's take note of these things, please. So moving on, we'll be talking now for women that are trying to conceive, fertility screening. So now, getting to this stage, I want to say something. Previously, I was telling you that before you get married, do these things. If you have done these things, some of these things here, you might not need to do it. Especially seminal fluid analysis, ultrasound investigation for yourself to know your status with you and your husband. But now, we've gotten to the fertility investigation. So if you're trying to conceive, these are the tests that they'll tell you to do. And please, let me rephrase. When I mean fertility investigation, I'm not talking about people that just got married yesterday. For you to actually start thinking that you have issue getting pregnant, you must have been married for like a year, having regular sex with your partner, having unprotected sex, uninterrupted, back to back, children of the world, you're happy. You are hearing back to back, you're happy. Okay, I said married couple, oh. I'm not talking to you people. You people, if you do anything, you carry your cross on your head, oh. So I'm talking about this, like, you must have been married for like 12 months for you to start determining that, oh, I can't get, don't let anybody put pressure on your head. Marriage of 2 months, please. Enjoy your marriage, oh. So these are the investigations that I'll be giving. They'll tell you to do an hormonal profile to know if there are any issues going on with your hormone. AMH means antimullary hormone. Is literally to check for women above 35 usually, or people that are planning to do an IVF, that we usually give this test to, so that we can see their ovarian reserve, how far and how everything is going. Pelvic ultrasound scan, of course, to see the situation and everything going on in the pelvis and your uterus and everything. And then we give an HSG, which is usually to check if the tubes are blocked. So whatever result you get from the ultrasound, sometimes they can indicate there to do an HSG. Maybe they notice something in the fallopian tubes or something, so they will tell you to do that. Seminal fluid analysis, emphasis on seminal fluid analysis for your partners. Because men don't know anything. Men will just tell you, I'm okay. You need to learn to lay emphasis on this for them. That please do it. Let's know if we need treatment or not. Don't let love blind you. Love is wicked, wicked, wicked. We go to dance some together. Before I answer you, if you DM me, and you DM me for something I've taught you before, and you go and fall inside the trap, love is wicked, 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 wicked. Okay now. So, moving on. So, after God has finally answered you, you have chopped the apple, Adam and Eve apple, and then you have carried belly. So you're pregnant. So to all expectant mothers, congratulations. It's not easy. Congratulations. You're doing very well. And to everybody that is looking to God for fruit of the womb, God will answer you. God will open the doors for you by the grace of God. Everything is going to work out fine. And to all the nursing mothers, you are doing very well. Well done. So pregnancy-related tests, these are things that I usually give. When you go on your first visit that you want to register for antenatal, they will give you some of these things. Blood group results, there's a reason why they are giving you this thing. Because there's something we call rhesus incompatibility. If you are rhesus positive, you don't really have much of a problem. But rhesus negative, they need to know your husband's zone. To know if there will not be any issue with the child. I will explain that to you briefly. HIV, sexually transmitted diseases, the infection, they need to know if you need treatment on time now before it's too late. PCV, to know your blood level, because as you are pregnant, you are carrying another baby inside, you're carrying another person inside of you, so you need this test to know what you need to know whether you need to be on some kind of medications or not. So now about that blood group I was just telling you about, rhesus factor. This is it. So rhesus factor, they need to, why is laid emphasis on negative? If it is negative and your husband is positive, they need to on time. In fact, immediately they find out, they need to start prepping your mind and explaining to you that there's an injection called Rogam that you'll be taking at a particular time and then after birth. So you need to know this and then know peace, my sister. Next, we'll be talking about women who have attained menopause. Women that are already above 45 years. Sometimes even some people attain menopause at 40. So, but usually, standardly, we say 45 and above. We tell them that they should do a mammogram yearly. We tell them that they need to do a thyroid investigation, because in this phase, they tend to have a lot of symptoms. We tell them to do a pelvic ultrasound scan to see the situation of their uterus and all of their pelvic organs, and then we tell them to do a blood pressure monitoring compulsorily, because at this age things tend to go left, go right, go center, so they need to monitor their blood pressure, their sugar level. So these are the main investigations. Other investigations listed here, they can be due to maybe complaints that they bring in, then you tell them that okay, you need to do this investigation. So these are basically the investigations that we tell them to do, because you need to follow up with them. Menopause is a very, very tedious phase. It's not easy during menopause. Menopause is actually something that they need to be applauded. Women need to be applauded for, because this phase, you see, shaggy. But anyways, God will see us through every phase of our lives. Amen. So thank you so much for watching. Thank you for following me today again. My name is Dr. Nikhil. As usual, thank you for showing up for me all the time. So today we've spoken about all the necessary things we needed to talk about, and please let's take note of these investigations. Aside from the jokes, let's please take note of the very interesting things that I said, the important things. If you don't know your genotype, please know it. If you don't know your blood group, check it out. If you're about to get married and you have not done this test, try, do it. Even if your wedding is next week Saturday, do it already now. It does not mean that your marriage will scatter or the plans will scatter, but just prepare your mind for what you're going in for. Men don't know anything, or you think men know, but they don't know. So please, let's take notes. Thank you very much for watching. Thank you for joining. Thank you for tuning in. All right. And I'll be sharing in the link below how to join our Women Health Club, and also how to watch our videos on TikTok and on Instagram and all platforms. Thank you very much.